For me, the biggest myth around mental health is that actually you only have mental health when you are unwell or you are struggling, when actually we have mental health all the time. We've all got a brain, we've all got thoughts and feelings, therefore we have to take care of our mental health in the same way that we would take care of our physical health. So I think for me, yeah, that's probably the biggest myth, that mental health only happens if you are struggling.
Okay, so if a parent's worried about their child or young person's mental health, there is a service called Contact Point, and that's across Hull and East Riding. And what we'll do is we'll put the number across the screen, so if people want that number, they will be able to know how to access that. But again, I would really encourage parents to think sometimes the voluntary sector can be really helpful, like Mind. We also have Head Start in Hull, so that can be another organisation that's really helpful. From a school perspective, Emma, what would your thoughts be? What would you advise schools?
I think for me, from a school's perspective, in the first instance, if your young person is struggling, I would try and seek some support through maybe the pastoral systems within school, if appropriate to meet your young person's need. Within schools, there is a lot of support across both Hull and East Riding. As Louise has mentioned, over in Hull we've got Head Start, and there's a number of different services that you should be able to contact via your young person's school. Over in the East Riding, we've got a number of services that are run by the local authority that are based around early intervention and support for emotional health and wellbeing. And we've also got the SMASH programme that works across both Hull and East Riding, predominantly in secondary schools, and the way to access that support is to contact your school, either pastoral support, head of year, or the SENCO, and they would be able to guide and support you to make that referral through to that service.
And I think the only other thing I would add is we also have a crisis service, and that crisis service is available 24 hours, 7 days a week, and can be contacted. And again, the information for that service is online on our web address.
So I guess there's a broad range of difficulties that young people might kind of access our services for help regarding their mental health. I think linking back to some of what Emma was saying earlier, obviously we all have mental health, and there are certain diagnostic kind of criteria that maybe sometimes are helpful for some families to understand why a young person might be presenting in the way that they are. I guess the way that we tend to approach working with young people and families in CAMHS is more a needs-led approach. I think we all have mental health difficulties, and at certain times in our lives we may have problems feeling low, problems with anxiety or worry, or something that people might call stress. There's lots of different words for probably what are describing the same thing. We would usually work with the families around what's most helpful for them, and I think what we know is that everybody's slightly different. We would probably take quite a normalising approach, and there are different ways that young people and families would choose to access services as well. So we do have some services that are predominantly online, like COOF, which the details of which are on the information page, where young people can access support online, because not for everybody face-to-face intervention isn't perhaps the most helpful. In terms of what's most commonly presented to us in CAMHS, I guess we get a lot of referrals for young people struggling with low mood, with anxiety and worries. We get young people struggling with self-harm, eating difficulties, and also problems with attention concentration, and maybe other developmental presentations that sometimes mean a young person might find some of managing their mental health a bit more difficult. But I guess we wouldn't necessarily categorise them in a way that perhaps isn't needs-led.
I mean, I would say parents are often the most well-placed people to know what's happening for their child. And I think sometimes it's about supporting parents to trust their gut or their sense of what might be different for their child. I think children behave differently at different developmental stages. So we may have a scenario where maybe you've got a teenager who spends a lot of time in their room, isn't really communicating very effectively with their parent, and the parent might be very worried about that. But actually that might be very normal and appropriate for their teenager, because it might be that they're getting more support from their peer contact and relationships. So sometimes part of our role is like Nicola was saying, it's normalising behaviours and trying to make sense of what that behaviour is about. And I think sometimes parents need a lot of reassurance or some support, and that doesn't have to be from us as a CAM service, that can be from their own kind of support networks, friends, family. And sometimes young people don't and can't talk to their parents, and just like we said around COOF, sometimes it is about supporting people to find their own ways of getting the help they need. And us as parents might find that difficult, but it's about being supportive about what our child might need and want, and helping direct them to get the support that they need.
Most definitely.
Yeah.
Most definitely. I think the key thing here is it's okay to talk, and I think that parents really should be very open from the very beginning, and have those normal conversations about actually, are we looking after ourselves today? So both from a physical perspective, from a healthy eating perspective, parents will be talking to their young people about their kind of food intake, their exercise, getting outdoors, fresh air, and actually part of that conversation should also be about parents talking about mental health as well, talking about thoughts and feelings, and asking their young person what is happening for them at this moment in time. It's really, really important that families do talk, and that young people feel that when they do need to share how they're feeling, that the parents will be there to listen. And that's not always easy, because parents have really, really busy lives, and as adults we've got our own mental health as well, and we've got to take care of ourselves. So sometimes that can be quite hard, but most definitely I would say that talking about mental health within the family home is really important.
I suppose just to add to that, I think it's okay not to be not okay as well, and I think parents showing their children that maybe sometimes they struggle too is absolutely fine. I think sometimes parents, and I'm a parent myself, so I know that when your child is struggling you want to fix it, and I guess with mental health it's a bit more complicated than that. It's not really something you can fix in the same way as you can give a pill for a headache. Talking is the main intervention and the strongest and most helpful thing that a parent has in their toolkit, really, and listening. And I think parents really underestimate how powerful that can be for their children. So I would say it's really, really important to talk about it, but also just acknowledge how important listening to your young person can be.
And I guess just to add one final thing to that about relationship, and actually parents often are the most well placed to talk to their child, because they have that relationship with their child. So I think it's really important never to underestimate the powerfulness of that. And for some parents who may feel, I don't know if I can talk to my child, or I don't know if I'm the best person, maybe it should be somebody else. It's about sometimes just supporting that parent to have some of those conversations with their child, and helping them normalise what might be happening for them and for their child. And just like Nicola said, it's okay not to be okay, whether you're a parent or a child.
What I'd say to anybody that was feeling that they wanted to reach out to services or get some help or advice, but were feeling they were avoiding that because of fears of stigma and stereotypes, I'd just say that's really understandable. It's really understandable to avoid things that make us anxious, make us distressed, and things that we don't understand. But at the same time, I would encourage those people to reach out. There's lots of information online now that you can have a look. There are booklets and online help for everything. That wouldn't exist if there weren't lots of people that needed that help. The reason that we have things like Shiny Minds and apps for helping people with mental health is because we need it, because it impacts on a lot of people. So I encourage people to have a look out there again, see what there is, and go and see your GP, or have an online session with the GP might be more likely at the moment, but have that conversation and get the ball rolling. It might be that you just need a quick chat, but it might be that there are more things out there for you.
Okay, so pain is a high unmet need for people that live in care homes. They are able to express that they're in pain as we are, so it may manifest in different ways. They may become more challenging or non-compliant with you. So we don't always know, so in those situations we would just recommend trial of some pain relief. And I think as people go through the dementia, I think these people should be on a low dose of pain relief. You'll see many people with dementia, they walk for hours and hours and hours, and you know yourself, if you've been for a long walk, how much your legs ache, so how much they're going to potentially be in some pain that we don't really consider.
I've really noticed a difference. People are really struggling. That's the people that come into our service users, staff, all people that I work around seem to be struggling. One thing that I was thinking about really was how much we rely on routines and the things that we normally choose to do to keep us happy, and how much that's really been disrupted. So I spoke earlier about connecting with other people. We found out in our service users, places they usually go to in order to mix with other people and to interact and have a sense of closeness and achievement have really been really difficult to access. So I think that's led to people struggling more and also not knowing sort of when things will come back to normal is a conversation people keep talking about. How about you?
Yeah, I resonate with that. Changes to people's routines and kind of losing connection for people, not just in the population that I work with, so working in adult mental health in the inpatient system, but also with my colleagues. So I've noticed that some of the people, some of the service users I work with, massive changes in their life has made really difficult emotions that they were managing before have become something that they're struggling with, and they've needed to access services. But also for some of my colleagues, changes to routines, having to work from home and not seeing their colleagues has been really, really difficult for those. So just offering support there has been something to watch out for.
Yeah, I think as a service and for psychology particularly, it's something that we need to be anticipating, that it's going to be, people are going to struggle, and this journey of sort of getting back to normal, we don't know how that's really going to look or what's ahead, and just to be mindful of it really, that we're going to need support and for us to be planning for that and thinking about what that might mean for us and our work going forward into the next year.